Our next speaker is Dr. Bernard Goldstein, Emeritus Dean and Professor of the Pitt Graduate School of Public Health, who will speak on the, he changed his title, so he's going to join us. And I forgot to change it in my sheet. So he will tell you what his title is. Welcome. Please welcome.
Thank you, and good morning to everyone. I changed my title a couple of times because they gave me this wonderful title of introductory remarks and a half an hour to do it, and that's sort of a speaker's license to steal equivalent. I mean, you could talk about anything. And I in thinking back, had spoken for the very first time outside of my place in New York City at the time on the environment at a League of Women Voters meeting in Toledo, Ohio, and that's about 1969 or 1970. And to me, the League of Women Voters worked very closely with them in New Jersey as one of the groups that really was poised to talk about information, about getting all the material out that we wanted that we needed to know to make decisions as citizens and as policymakers, such as Dr. Hacker. It had occurred to me that if I would have spoken at a meeting of yours 3 years ago, when you asked me to speak about the environment, I would have told you about speaking 40 years before, and I would have relatively smugly told you about how far we had gotten since those bad old days before we knew as much as we knew now, and how we were doing a much better job of regulating and of controlling and of preventing environmental problems. Then along came shale gas. And I can't say that. We're basically going backwards. This is, to me, a form of almost, I call it environmental recidivism. And in many ways, the problem is controlling information. And so what I'm going to talk about is obfuscation and having to do with what we're being told about these issues that may or may not be all that pertinent to our going forward with the right decisions. I throw up a whole bunch of basically papers that have come out of our program. I do that in part because there's an excellent conference on Monday and Tuesday at Duquesne. I hope a lot of you will be able to go there. But it's specifically limited to programs, to research that's being supported now by foundations. None of our current research is being supported by foundations, so you won't hear about it. I'm going to weave some of this research in midst of my talk, but the major focus is going to be on the issue of how do we interpret what's happening when we're not told much about it. Obfuscation, I pulled the definition out, is or beclouding is the hiding of attended meeting and communication, making communication confusing, willfully ambiguous, and harder to interpret. And I'm going to talk about how this is being done by industry and government. And I want to immediately say it's not all industry and it's not all government. It's very easy to generalize. There are some, if you will, good guys out there, and we need to basically make sure that they get credit for when they do try to be responsive to what we need to know as the public. I also want to make sure that you understand that I do believe that there are potential health benefits. Replacement of coal and power generation, and there's a whole bunch of problems that we have, particularly in southwestern Pennsylvania, which could be ameliorated by replacing coal with natural gas. And there is a probable, in my view, decrease in greenhouse gas emissions, although that's a very controversial subject. You'll hear more about it, and there may not be. To me, the issue is not whether or not there is a replacement in greenhouse gas emissions. The issue really is there is no question that methane is being released into the atmosphere that is now locked deep underground. We should be releasing as less as we possibly can. There's no excuse to release something which basically the industry can sell, and that's their job of selling this stuff. They should be held to the strictest standards. So again, it's the wrong argument. Is it better or is it going to be worse than coal? It's not really where the argument should be. It should be as little as you possibly can, and we've got to make sure that it is as little as it possibly can, because it doesn't do any good to release it up to the atmosphere and participate in greenhouse gas. My view about this from the time that I got involved in it a few years ago is that what's the rush? Sustainability is something we've all heard about, we talk about. Sustainability is basically looking toward the future. The issue really is, what is the advantage or disadvantage of beginning now and going, say, for 20 or 30 years on this limited resource, or beginning 5 years from now and going to 5 years longer? If you really believe that this is good, and lots of people do, well, you have to really address that question somewhere along the way. And I'll come back to it a bit in time. When I first wrote an op-ed about this, it was at a time that the Deepwater Horizon Commission of President Obama had basically said, you know, we have to start drilling again, and in large part, because if we don't get that oil, which we need for all sorts of reasons, and I won't bother to bore you with the arguments that are given, if we don't get that oil in this international water, the Cubans will get it, or the Venezuelans, or the Chinese will come and get it, and it should go to the United States. So I've been joking ever since then about how we have to get that shale gas now, because otherwise the Canadians are going to horizontally drill under Lake Erie and steal our shale gas. This stuff isn't going anywhere. It's there. We can take it when we want it, when we need it. Now, the issue of when you do things is important. From a public health point of view, we face that. As a toxicologist, we face that with a new drug. I mean, it's really tragic to be the last person to die of a disease which is cured by a drug that is going to be approved by the FDA for release tomorrow, right? But this is a limited resource. A new drug, once it's approved, it's there, we've got it. This is a limited resource. It's there for a certain period of time. We have to think of it in that sustainable way. And so my argument has been, what's the rush? Now, I don't know if any of you can identify this person. I went to EPA in 1983 as head of research and development as an academic scientist. And I always, as an academic at medical school, felt best about showing a picture of Hippocrates or Galen or someone like that and so I introduce a lecture. So I needed someone to epitomize the use of toxicological information for governmental purposes. Anybody know what this is? It's Lucretia Borgia. You know, and when you think of it, there's no League of Women Voters there. Now, Dante Rossetti in this picture has in the corner, he's got two men speaking to each other. That's her brother Cesare, who heads Rome, and her father, the Pope. And they made decisions among themselves. There was no Congress. Basically, they were able to make the decisions. That's not what we have today. We have an informed electorate. We have processes. We have the press. We need to be able to make decisions, not secretly, but openly, with everyone involved. Now, but this is yet another person that it really, to me, typifies where we are right now. Any of you ever hear, some of you folks are old enough to perhaps remember Willie Sutton? Okay, so Willie Sutton's a very famous bank robber. Press love him, and he's reputed to have answered a journalist's question about, Willie, why do you rob banks? By saying, because that's where the money is. It's terrible to do these kind of talks and look this up to be sure I've got my facts right and then find out that that story is apparently apocryphal. He never really said it. But let's make believe he did, because it became a medical law. There's something called Suttons Law. It's taught in medical school, and it basically means you go right to the most important piece of information. So if somebody comes, we notice we've got a lump in our neck, and it's a lymph node, and the doc looks at it and says, oh yeah, you got a lump there. Well, there's probably 100 possible diagnoses. It could be an infectious disease, a cancer, an immune disorder. You can do test after test, blood test, x-ray. Yeah, Sutton's Law says you go take the doggone thing out and look it under a microscope. Okay? Well, Sutton's Law, as applied to what we're talking about, would say that, look, if we're concerned about public health and the environment, let's look at public health and the environment. Let's look at the ecosystems that could be affected. Let's look at humans that could be affected. And we particularly have to do this because of the broad, diverse threats that a Marcellus Shale operation basically presents to us. Resources for the Future did a study in which they were eliciting expert opinion as to what could go wrong. And so they gave a whole list of things that they thought could go wrong, and they wanted to know from experts which were the most likely ones. Their list were 264 different items long. There are so many different parts of this, from the time you start delivering materials to the site, you're leveling the site, after the work that you're doing on the site, afterwards. There are so many different things that go wrong. It's not obvious whether it's going to go through water, through air, how it's going to go, what the pathways are going to be. In that case, where it isn't obvious, it isn't direct, you really have to measure the receptor. We're the receptors. Lily's law is being violated as we go through this. People are concerned, I'm going to go quickly because we started a little late, but people are concerned about unsaturated, about this Marcellus Shale drilling. This is just looking at folks who testified in Washington, PA. Perhaps some of you did. You had 2 minutes to talk, and we analyzed what you said. And a large percentage of the people are concerned about their effects on health. You all know, I think, but I put in some slides just because I knew I was the first speaker, about the shale gas that it's throughout our state and the area. The way this is done is to drill perhaps a mile underground vertically and then move horizontally, blow holes in this horizontal portion. You have tightly bound shale gas. You put in water under pressure, high pressure, with all of these hydraulic fracturing agents and proppants, and then you pull out the gas that comes out. Very important, but no one really talks of it very much, is the fact that you don't get all the gas. They're not sure how much you get, but it's various estimates range that I've seen range from 6% to in the upper 30s of the gas that's down there. Remember, you're blowing, this is tightly bound, you can't get your holes everywhere, and the industry is getting better and better at doing this, which means they're getting more and more gas out, which goes back to the so what's the rush story that I gave before. When you think of it, let's assume that New York State does start, after their next election, does start doing their shale gas drilling. I'm not advocating for or against it, but when they do, these folks will have learned from Pennsylvania to do two things better. They'll do a better job with casing, and they'll do a better job with their ponds and their lining, so they're less likely to have any problems than they have now. They don't want to have these problems. And they will take out more gas from the same amount of shale that's down there because they're getting better at getting the gas out. So they'll make more money. They'll have less harm to the public and make more money. Gee, they don't tell us that, do they? You've seen these drill pads. They're large. They're crowded. From an occupational health point of view, they really are a potential problem to anyone working on it. They're present in rural areas. They're present in semi-rural areas. We are looking at doing this in Allegheny County now, or more in Allegheny County, and that's going to be certainly be an issue. It already is. And there's lots of sources of contamination from the casings and all these other areas. And again, I'm going to go quickly because I wanted to catch us up. There's lots of additives for fracking. Very important, these additives keep changing. The chemical industry is doing a very good job of developing even better chemicals that can be put down below that will do a better job of pulling out the gas, so you get more and more gas. And that's what they should be doing. They should be selling into the drilling industry. The drilling industry is always experimenting with these things. So when you hear, and I'll go into this, when you keep hearing these things, oh, we've been doing this for 60 years. Yeah, but not with these chemicals. In fact, you're not doing it with the same chemicals you're doing a couple of years ago. Keep on changing these things. There's three major sources of toxicological agents of interest. I'll put on my hat as a toxicologist. One is that we know a lot about, is the hydrofracturing agents. Okay? Another is the hydrocarbons and gases that are present that you bring up from below. Natural gas is mostly methane, but in areas, some areas of the country, there is what's called wet gas, which means it's got higher molecular weight compounds in it, including benzene and toluene, and other compounds that we perhaps have more of concern about than methane. In the southwestern Pennsylvania, we're a wet gas area. That's good from the point of view economics. I mean, economically, the wetter part of the mixture is worth more than the methane itself, and that's why there's been continued activities here and much less continued activities up in the Northeast, which is mostly dry gas. But then I've told you about these two mixtures I'm less concerned about those than I am about the natural constituents that are present below and are brought up from underground. I'm concerned about it from a toxicological point of view, about these chemicals that are naturally present we're bringing up from underground, include lots of things which are bad actors. I'm concerned about it because I have less of a belief the industry is going to work real hard on this than I do of the first two. The hydrofracturing agents, remember, are compounds that they buy. It's in their best interest to minimize the amount that they have to buy, to recycle as much as they can. So there's at least that economic driver there. The hydrocarbons that they bring up, they also have an economic driver. That's what they sell. So again, it's in their best interest not to release these things if they possibly can avoid it. But these natural constituents, there's nothing for it in that. They're just a problem. And I'll go through this in terms of obfuscation. What we haven't been told, let me put it this way, I think those of you who've been following this remember early on as this started to develop, we were reassured by the governor's office, by industry, not to worry, there's plenty of water in Pennsylvania. And from the point of view of the amount of free-flowing water, I think we're second to Alaska in that, and there's lots of water here compared to other states like Texas and Colorado, where water shortage is a major problem, and it's a major issue, far greater issue than it is for us, although it's still an issue for us. Now, that's nice. They could explain how we're different from the West, and that makes sense. But they never said to us, we're also different from the West, in that out West, what they do, by and large, is when the flowback water comes up from underground with all these constituents in it, they put it right into a deep underground injection well. We hardly have deep underground injection wells in Pennsylvania. We've got to put this stuff somewhere. That's our problem, in terms of, if you will, to me, the highest ranking problem. And the mixtures issue, we don't know what these mixtures are going to do. And the chemical reactions, David Brown's here and pointed out that high temperature with lots of chemicals is what we learned in high school chemistry to be called a retort. That's how you get chemical reactions to occur. I will show you the language in Act 13, which says that we're not supposed to find out anything about this. Again, obfuscation. What are the potential impacts? Well, there's safety issues, there's air pollution, there's water pollution, light and noise, psychosocial effects. You'll hear more about these as the day goes on. You also have to keep in mind the fact that this industry overall is an industry without much of a peer structure. There's been very, very nice studies done on this, building on this data that comes from Frac Tracker and from some of my colleagues whose names you saw on the original slide I showed. This was looking at the number of wells drilled for operators who had at least 10 or more Marcellus Shale wells in Pennsylvania, and how often that the State Department of Environmental Protection had said that these folks had been in violation. And the key point here is that there's about a half dozen of these operators that have had no violations whatsoever. They've performed appropriately. There's a half dozen that have more than twice as many violations as they have wells. There's an enormous spread. And the issue is, you don't know which one you're next to. These companies buy in, buy out. The issue is, right now, we've got to be lucky about where we live rather than be reasonably assured that these kind of problems are not going to occur. There's a very nice study related to methane. At least I think it's a nice study. You'll hear perhaps other views about it later today. That was done with the Environmental Defense Fund, the Heinz folks funding, and done by faculty at the University of Texas and elsewhere, where they looked at methane release at different locations, and they came out with data suggesting that having to do with greenhouse gas. I won't go into the details of it, but the key point about it, from the point of view of, are we worried if the question is, gee, Doc, they're going to build, they're going to frack right across the creek from me, or right up, right in the next field. Do I have to worry? The key point from that study, if you look closely at it, is the enormous variation from site to site. Even when it was the same drilling company, and they were drilling sites right next to each other, there's tremendous variation in the amount of methane released. Well, they only measured methane, but any of the other constituents would come out like methane. So if there's methane, if there's benzene there with the benzene would come out as well. So the methane is an indicator for the other constituents, and the key point is that they're not rigorously controlling what they're doing, even the same company, even right next to each other. And again, to answer that question, Doc, my response has got to be, well, get lucky, be next to the site that isn't releasing a lot. We've got to do better than that. Okay. What's been happening? Here's from a study that we did just to look at the executive orders and the composition of committees that were put together by President Obama, by the governor of Maryland, a Democrat, and the governor of Pennsylvania, a Republican. And all three of them say that they're concerned about health and you need advice on it. There were 52 members of these three commissions. The amount of people with any health background whatsoever was zero. I mean, zero. I spent a lot of time in New Jersey. Very often they would put some, it's usually a male physician on whose major attribute of being knowledgeable about this environmental matter under concern was that he was the local treasurer for the Democratic or Republican county party, depending on who the governor was. I mean, there wasn't even an attempt to cloud the issue by having somebody on there who was not knowledgeable. Simply no one. And this is across the country. What we do have in Pennsylvania is the most egregious. There were 31 members of this Marcellus Shale Commission. There were 8 heads of various state agencies that were part of it, but not the Pennsylvania Department of Health. There was no one from the Pennsylvania Department of Health on this group. What happened was the Marcellus Shale Commission came out with various recommendations, including a recommendation to fund the Department of Health to do routine surveillance kind of work that every Department of Health would do in a circumstance of this nature. That funding did not come through. If you look at Act 13, we have close to $200 million on the impact fee. Here's 17 state agencies, sub-agencies, and commissions that get a piece of this money. Not one penny goes to the State Department of Health. The only valid interpretation of this is that, well, clearly the governor is sure that there is no impact, so there's no sense giving the Department of Health any money to be able to do anything. In our state, that's particularly problematic. We are one of the states that does not have an independent board that overviews our State Department of Health. Allegheny County, the head of our Allegheny County Health Department reports to an independent board. Clearly, the board is appointed by the county executive, and there's always going to be some tension there, but in public health, that's really important. Our state doesn't have that, and our only counties that have boards of health and independent health departments are in our larger counties, which don't have much fracking because, hardly any, because this is something that happens in rural areas. Our rural counties are all controlled by the State Health Department. And the State Health Department, by the way, has a superb environmental health indicator program. It's a program that's been funded since 2002. I think it's one of the 4 states that's been able to do this, working with the CDC. The Environmental Health Indicator Project and folks in the State Health Department have been told, do not respond to the issue of shale gas. I mean, it's the logical group to do it. It's embarrassing not to have a nationally recognized organization, the Pennsylvania Departments of Health Environmental Health Indicator Project, not be part of something that clearly Pennsylvania's got a major stake in. But that's what's happening. I'm told, I don't know if this is a fact, perhaps people here can confirm it, that for a local health department, if you call with a complaint, to a public health nurse, for the public health nurse to be able to go and respond to your complaint, she needs to sign off from at the deputy secretary level in Harrisburg. This is hiding things. Well, what else is happening? We've got the issue of is hydrofracturing old or new? We're told over and over again that we've got this wonderful new technology that it now allows us to get this gas, which we've long known has been down there, but now we can get it for all these benefits. But then when you question it, we're told, oh, don't worry about it, we've been doing it for decades. You can't be old and new at the same time. It's one or the other, right? It is something, hydrofracturing has been going on for decades, but this is equivalent to saying that hydrofracturing is no different than it was before, when it was 50,000 gallons rather than 5 million gallons, when the pressures were much less, when you weren't doing horizontal drilling. That's wrong. There's a study that basically demonstrates this. This is a study funded by the America's Natural Gas Association, ANGA, to basically look at childhood cancer incidence in Pennsylvania counties in relation to living in counties with hydraulic fracturing sites, published in a reasonably good journal in July. And the conclusion is this study offers comfort concerning health effects of hydrofracturing on childhood cancers because they didn't find any increase. You and I think of this issue as being one that's relatively recent because it's only relatively recently that this new approaches have been used in Pennsylvania. Approaches which, when the fluid comes out, overwhelms our publicly owned treatment works and our usual ways of dealing with flowback fluids or dealing with industrial water waste. And here's from the Department of Environmental Protection website how this is developed, almost no wells before 2005, 2006, and now we're up to 2011, up to 2000. Well, here's what the American Natural Gas Association scientists who published this paper said. They said, well, we've been doing this for years, and they can check childhood cancer in these counties from the 10 years before to the 10 years after this really got going in the counties. Well, cancer, it's a terrible thing, but even for children, there's usually about a 4-year lag period for leukemia. There's at least a couple-year lag period. They're looking at cancer incidence to 2009. Well, we didn't have any drilling before 2009. They can't possibly see anything. But yet they claim that this offers comfort. So this is the kind of obfuscation you're going to see. There's no comfort from this. Basically, you can't look at this issue yet because we haven't been doing it long enough, but yet papers being published about it. The issue of, does hydrofracturing cause groundwater contamination? Well, I happen to believe that if you successfully release these chemicals 5,000 foot underground, it's unlikely to get to the surface, to the groundwater areas. But that's not what the public is asking. The public is asking, you're going to go right across the stream from me, you're going to level this drill pad, you're going to be here 10, 20 years. During that time, will my groundwater get contaminated? And the answer is, well, yeah, there's some likelihood. The truck might overturn, the casing might blow, the wells might leak. It has nothing to do necessarily with 5,000 foot underground coming to the surface. Industry basically argues that they're permitted to use their definition of hydrofracturing. That's not the right definition of hydrofracturing. The right definition of hydrofracturing is what the public understands it to be, and the public understands it to be the entire activities related to Marcellus Shale drilling, not just the successful release of chemicals 5,000 foot underground. I know that time is getting down, so I'll conclude with one of my favorite slides for medical students. It says, look, lady, you're the one who asked for a famous movie star with dark hair, strong nose, and deep-set eyes. It basically to make the point that we, as physicians, as experts, very often do not respond to what the public expects from us. This woman obviously did not expect this, and well, the physician's absolutely correct in the idea of a famous movie star with dark hair and strong nose and deep-set eyes. The physician's responsibility is to understand what the patient's asking. Industry's responsibility, government's responsibility is to understand what we're asking, what the public is asking, how the public is using the term hydrofracturing, not how they're using it in this very narrow sense. There are many other examples I have here of obfuscation. Can't go through them all. But I will tell you that when we look at what we're being told, we have to look at it very carefully, and we have to demand of our public officials that they tell us what it is that we understand. So I will conclude with some testimony, so you don't think I'm just hand-waving, from our original head of the State Department of Environmental Protection under Governor Corbett. His testimony in Congress, he says there's been a misconception that the hydraulic fracturing of wells can or has caused contamination of water wells. This is false. Well, yeah, if he defines hydraulic fracturing as the successful release 5,000 foot underground of these chemicals. It's only a temporary feature of natural gas development, which only lasts a few weeks. Yeah, if you assume that your drilling pad's only going to do one hydraulic fracture, but in fact, what's happening now is they're doing 8, 10, 12. Did come across an individual who thought that he'd only have to worry about this for a couple of weeks, and in fact, it extended to close to 6 months because over and over again they frack from the same drilling pad. So you end up with not just a couple of weeks, you end up with 6 months, and people know that. And again, this issue, it's not new. It's been going on here since the 1950s. No, it is new. What we're seeing over and over again is what we call the social amplification of risk. What we see in people who believe their health has been affected. I don't know that they are, but when we study them, when we ask them what their problems are, they tell us about noise. They tell us about the air smells bad, the water tastes bad. You're talking about 45% of people at most talk about noise, and then the others are less than that, of the physical stressors. But they also spontaneously, in about 60 or 70% of them, talk about the fact that nobody's answering the phone, nobody's responding to us, they're lying to us. These are the kind of things that just absolutely expand the extent of stress and concern that the public has, and they're absolutely unnecessary if we're going to be able to move forward with understanding and appropriately managing this very challenging issue. Thank you.